right. So thank you very much for the invitation. Dr. Lindsay and I just recently found each other through an initiative at the American College of Sports Medicine. So very thankful to be a late ad and to be able to join you guys, even if virtually, only at this terrific and much needed meeting. So I am a professor at Case Western Reserve University, and that is in Ohio, which is not in the West. But I'll explain a little bit about my Western connections, and hopefully we'll be able to sort of extend our collaborative work with you all soon. So I just want to talk about one initiative that we're working on with regards to nutrition, since that's been the focus of today, and I think ties in nicely with some of the things you've been discussing already. And that is my work as an ambassador for the Society of Behavioral Medicine. And as part of this initiative, we basically try to make position statements and reach out to policymakers and their staff to try to help better educate them on nutritional issues. And one that we're working on now that should be released very soon. In fact, it was supposed to be released today, but there's some promotional things on that end that's holding it back, it looks like, for another week. But basically, this is about urging the passing of the Restore Act. And this is going to repeal the lifetime ban on basically the withholding of SNAP and other benefits to people who have a drug felony. So as many of you know, many of the jails or incarcerated population in the US have a substance use disorder, and many of them are in minority populations that are already underserved. So this is hopefully going to get passed, and we're going to be able to get the nutrition services to people who potentially need it most. Another project that we're working on is been funded by the HEAL Initiative, which is an NIH, National Institute of Health, helping to end addiction long-term, big initiative, which has funded many trials, including ours, which is trying to integrate exercise and psychotherapy to treat pain and addiction in people with opioid use disorder. And so this was funded under a newer mechanism, which is called an R61, R33. And this is a really cool mechanism because it allowed us to do formative work up front. We did interviews with participants / clients in the treatment centers, as well as focus groups with the treatment center staff. And then we were able to do a pilot trial before we actually got started with a large trial. And we're actually underway with a large trial now, which is basically a factorial trial that allows us to look at the individual benefits or effects of exercise, as well as the psychotherapy components, alone and in combination. And so I thought it might be helpful to provide a little bit of rationale for why we're doing what we're doing. I know we're a little behind, so I will keep this to a minimum. But basically, I know you're all familiar with the opioid epidemic and a lot of the statistics around that you've heard already today. So just say that, adults with opioid use disorder and chronic pain are 3 to 5 times more likely to relapse than those with just opioid use disorder. And, why this is so important is because currently the drug treatment centers are not helping to address the issues of pain. So we're trying to integrate this psychotherapy for pain and also exercise, to try to help with addressing the pain, since it's not currently being addressed, at least not in most treatment centers. Obviously, exercise we know is medicine. Probably don't have to convince you guys of that, but there is a fair amount of evidence that shows so far that exercise can increase abstinence and decrease anxiety and depression in adults with a substance use disorder. But there haven't been very many trials that have actually focused on people with opioid use disorder, and there haven't been any that really have looked at that population that have OUD and chronic pain. So exercise also is a great stimulus to induce analgesia through endogenous opioid, serotonin, and endocannabinoid systems. And the effects may be even greater with higher intensities of exercise. We also have a fair amount of evidence that adults with substance use disorder have a higher risk of cardiopulmonary comorbidities, and a lot of things like hypertension, COPD, etc., can actually be treated well with exercise, and definitely exercise can make improvements on those fronts. There's a little bit of evidence, only a couple studies, but basically there are a few that show that the fitness level of folks, adults in particular, that have substance use disorder is lower than the norms. Not surprising, given the other comorbidities, but more work in this area needs to be done. And clearly exercise can help improve cardiorespiratory fitness, which also has an impact on overall mortality. Also, the medications used to treat opioid use disorder, or MOUD, basically methadone has been shown to increase weight. A couple of the other MOUDs that are being used right now also may enhance weight gain, and this effect seems to be greater in females. And so, as Dr. Lindsay mentioned earlier, there's sort of this interplay with drug use and being able to have weight loss or to keep weight maintained. And so clearly in people that have a substance use disorder, we want to be able to find ways to help them deal with the weight loss through nutrition, as well as through exercise, and also to try to help maintain that weight loss through exercise and good nutrition. So exercise also, particularly at higher intensities, can help induce neurogenesis, angiogenesis, and hippocampal volume. And, this might be incredibly helpful during recovery, because there's a lot of cognitive behavioral therapies and other types of treatments that really, are requiring a lot of cognitive help from these patients, basically, during the recovery. So exercise can only help with these stimuli. We've actually been developing a technology called assisted exercise, which enables people to pedal about 30 or 35% faster than they do on their own. And in Parkinson's patients, we've seen that the assisted exercise helps to alleviate their tremors and improve their global motor unit function. And we've actually seen neural activation patterns which mimic the drug levodopa, which is a dopamine precursor that when it gets through the blood-brain barrier of the brain, it basically is eliciting dopamine. And so in our neuroimaging, we've seen that the cortical and subcortical areas of the brain basically, again, are mimicking the levodopa administration. So basically, they go off the levodopa, they get on the assisted exercise bikes, and we neuroimage them, and we see the same pattern. So this is suggesting that there's a modulation of dopamine with the assisted exercise. And so our hypothesis is in people with substance use disorder that we might be able to have similar effects. It's not a panacea, but it may just be that a little bit that's enough to, offset the reward, the trigger to go back to substances. So again, this trial is underway, and we're in the R33 phase, which is shown here on the slide on the right. We also received a supplement to try to evaluate the multiple dimensions of stigma and implicit association better in people with substance use disorder. So this can be, self-internalized dimensions, anticipated or perceived based on prior enacted stigma. And of course, stigma can be enacted by, unfortunately, sometimes family and friends, society as a whole, the healthcare system, criminal justice system, and even their own peers. And so we're particularly interested in this stigma associated with the medications around opioid use disorder. And, we're hearing a lot in our interviews and focus groups around, this stigma associated with, using the OUD as a crutch, not being really in recovery, etc. So we're very interested in that dimension. So finally, my connection to the West. We're here in Ohio, and most of the treatment centers that we're collaborating with on our trial involving the exercise and psychotherapy for pain have been here in Ohio. But my collaborator, who is helping with the psychotherapy piece, is actually out in Denver, Colorado, and we're excited to finally be starting up soon some of her sites out there in Colorado. So I know that was a lot really quickly, but I wanted to thank Dr. Lindsay and others for the opportunity to jump in on your meeting. And really, I've enjoyed myself a lot and learning a lot about all the great initiatives that you guys are working on. So I'm looking forward to discussing some of these things further with you all soon.